Hey everyone, and welcome back. So today we're going to do a deep dive into all things urology.
Sounds interesting.
Yeah, it is, right? And it's all thanks to these medical school notes that you send us.
Hi.
So it'll be like peeking into med school, even if you've never even, thought about being a doctor.
I like it.
Yeah. Ever wondered, like, how your kidneys work? Or what those, pesky kidney stones are all about?
Oh, yeah.
Or how doctors deal with the serious stuff like prostate and bladder cancer?
Definitely.
Yeah. Well,
Get ready. Buckle up.
yeah, for some fascinating insights. Think of it this way. These notes are kind of like a cheat sheet
Okay.
for understanding the urinary system from, just everyday annoyances to some really big health challenges.
A to Z.
Yeah. And there's some stuff in here that every parent needs to know, especially parents about this thing called testicular torsion. It's a real medical emergency.
Wow.
But we'll get to that later. First, let's start with something that affects millions of people. Lower urinary tract symptoms. LUTS.
LUTS.
LUTS. Yeah, not exactly a catchy name, but trust me, this is important.
It sounds important.
Yeah. So what are LUTS exactly?
Okay, so imagine you constantly feel like you need to pee,
Okay.
right? And when you do go, it's just a trickle.
Oh,
Or maybe you're waking up multiple times during the night to use the bathroom.
yeah, I've heard that one.
Sounds familiar.
Yeah, those are not fun.
No. Well, these are all examples of LUTS.
Yeah.
And they can be caused by, a bunch of different things.
So we're talking about, like, anything that makes going to the bathroom a less than pleasant experience?
Exactly.
Okay.
Doctors break down LUTS into three main categories.
Yeah.
Storage symptoms,
Right.
voiding symptoms,
Okay.
and post-micturition symptoms.
So storage symptoms are what? Like problems holding your pee?
Yeah, exactly. Like
Yeah.
frequency, urgency, nocturia, which is the nighttime urination,
Oh,
and even incontinence, leaking urine.
yeah.
No.
So that's storage. What about voiding?
Voiding symptoms are all about trouble actually peeing.
Oh, okay.
So this could be like hesitancy, straining to go, a weak stream, or even that frustrating stop and start situation,
Oh, yeah.
mid-flow.
Yeah.
And sometimes you might feel like you haven't completely emptied your bladder,
Okay.
even after you've, finished.
And then there's that awkward moment when you think you're done.
Exactly. That's where the post-micturition symptoms come in, like dripping after you thought you were finished.
Right. Okay, so if any of this is ringing a bell for you listeners out there, know that you're not alone.
Very common.
Yeah. These symptoms are more common than you might think.
Definitely.
Now let's talk about something that can be, well, a bit scary.
Yeah.
Hematuria.
Hematuria.
Yeah, which means blood in your urine.
Right.
I know, if I saw that, I'd be freaking out.
It's definitely something to pay attention to, but don't panic
Okay.
just yet, because it's not always a sign of something serious. Did you know even something as simple as eating beets can turn your urine red?
Really?
Yeah. It might look like blood,
Wow.
but it's just a harmless pigment from the beets.
Wow, that's a good party trick.
Right.
Hey, look at my beet-colored pee.
But in all seriousness, if you do see blood in your urine, it's important to get it checked out by a doctor to figure out what's going on.
Right.
It could be something minor like a urinary tract infection,
Okay.
or something more serious like kidney stones,
Right.
or even bladder cancer.
Okay.
These notes mentioned like a whole range of possibilities.
So let's talk about kidney stones.
Okay.
I've heard those can be incredibly painful.
They are.
So what exactly are they?
Imagine little hard crystals
Okay.
forming inside your kidneys.
Ow.
That's what kidney stones are. They happen when certain substances in your urine, like calcium or uric acid,
Okay.
become too concentrated and start, sticking together.
So it's like rock candy, but inside your kidneys.
Exactly. And just like rock candy, comes in different colors, kidney stones also come in different types.
Oh, okay.
The most common type is calcium oxalate, followed by uric acid stones.
Okay.
Now, here's a fascinating fact.
Okay.
Uric acid stones are actually invisible on X-rays.
Really?
Yeah. They're what doctors call radiolucent.
Okay.
And that's why it's important for doctors to use, a variety of tests to find them.
You can't just rely on the X-ray.
Right, exactly.
Okay.
And then there are struvite stones, which are often associated with urinary tract infections.
Okay.
And then there are cystine stones, which are pretty rare.
Okay. And what causes these stones to form in the first place?
Well, not drinking enough fluids is a big one,
Okay.
especially, if you live in a hot climate. you're sweating a lot.
Right, makes sense. Your urine gets more concentrated if you're dehydrated,
Yeah.
so it's easier for those crystals to form.
Right. And your diet can also play a role.
Yeah.
For example, eating a lot of calcium and oxalate-rich foods can increase your risk of calcium oxalate stones.
Okay.
For uric acid stones, a diet high in purines found in, things like red meat and shellfish
Okay.
can be a problem.
Okay, so what happens when one of these stones decides to make a break for it and tries to leave your kidney?
That's when things get really unpleasant.
Okay.
As a stone travels down the ureter, which is the tube that connects your kidney to your bladder,
Right.
it can cause excruciating pain
Oh.
called ureteric colic.
Ureteric colic.
Ureteric colic.
Mhm.
Imagine like a sharp cramping pain in your side or back that can even radiate down to your groin.
Oh, wow.
It can be so intense, it's often mistaken for other conditions like appendicitis.
Wow.
It's rough.
That sounds terrible.
It is.
Thankfully, doctors have ways to manage the pain and make the stones pass.
Yeah.
Okay, moving on from those little troublemakers, let's talk about the prostate.
Okay.
Specifically, prostatitis.
Prostatitis.
Which is when this gland gets inflamed.
Right.
Why does that happen?
Well, there are two main types of prostatitis,
Okay.
acute and chronic.
Okay.
Acute prostatitis usually comes on suddenly,
Okay.
and it's typically caused by a bacterial infection. It's like a UTI.
Okay.
But in the prostate,
Oh, okay.
you might experience painful urination, fever, chills, the whole 9 yards.
Okay, so how does chronic prostatitis differ from the acute form?
Chronic prostatitis is more of a long-term issue,
Okay.
and it can be caused by recurring infections, but sometimes the cause is unknown.
Okay.
Symptoms are similar to acute prostatitis,
Okay.
but typically less severe
Okay.
and without the fever.
Now let's talk about something that a lot of men worry about as they get older.
Oh, yeah.
Benign prostatic hyperplasia,
BPAs.
BPH.
Yeah.
What exactly is going on there?
So BPH is a very common condition in men over 50 where the prostate gland starts to, grow larger than normal.
Okay.
It's important to remember that BPH is not cancer,
Okay, that's good.
but it can definitely cause some, uncomfortable urinary symptoms.
So why does the prostate decide to enlarge like that?
So think of it like this.
Yeah.
As men age,
Okay.
the prostate can be subjected to, these tiny repetitive injuries,
Okay.
which can trigger cell growth in the area.
Okay.
This leads to the formation of what's called an adenoma,
Adenoma.
which is basically a benign growth.
Okay.
At the same time, hormonal changes
Yeah.
associated with aging can further, stimulate prostate cell growth.
So it's kind of like a perfect storm of factors.
Exactly. It's a normal part of aging.
Okay.
And about half of men will develop BPH by the time they reach 60.
Wow, so that's a lot of guys.
It is.
So where exactly does this growth happen in the prostate?
So it usually happens in the transitional zone,
Okay.
which is the area closest to the urethra,
Okay.
the tube that carries urine out of the bladder.
Right.
As the prostate enlarges, it can, squeeze the urethra,
Okay.
making it harder to pee.
Ah, so that's where the trouble starts.
Exactly.
What kind of symptoms are we talking about here?
So imagine trying to water your garden with, like, a kinked hose.
Okay.
That's kind of what's happening with BPH.
Oh, okay.
You might experience hesitancy, a weak stream, dribbling after you finish peeing, and that feeling that you haven't completely emptied your bladder.
Ugh.
Yeah.
And what would a doctor find during a physical exam?
During a digital rectal exam,
Okay.
where the doctor feels the prostate through the rectum,
Okay.
the prostate would typically feel enlarged, firm, smooth, and rubbery.
Oh, okay.
Kind of like a bouncy ball.
Okay. So it's important to remember that BPH itself isn't dangerous, right?
Right.
It's not life-threatening.
It's not life-threatening.
But if left untreated, it can lead to complications.
Exactly.
Think about it. If your bladder isn't emptying completely, that stagnant urine
Right.
can become a breeding ground for bacteria,
Yes.
leading to UTIs.
Yes.
And in more severe cases, the blocked urine flow can back up all the way to your kidneys,
Right.
causing them to swell,
Yes.
which is called hydronephrosis.
Hydronephrosis, that's it.
So if you're experiencing these symptoms, definitely get checked out
See a doctor.
by a doctor, yeah. How do they diagnose BPH?
It's mostly based on your symptoms and a physical exam.
Okay.
A doctor might also measure how much urine is left in your bladder after you pee to see if you're, emptying it properly.
Okay. And what can be done about BPH?
The good news is there are several treatment options,
Okay.
depending on the severity of your symptoms.
Okay.
If your symptoms are mild, sometimes a watchful waiting approach is all that's needed, where
Okay.
you monitor the situation
Okay.
and only intervene if things get worse.
Okay, so no need to rush into treatment if it's not causing major problems.
Right. But if your symptoms are really bothersome, there are medications that can help.
Okay.
One type is called 5-alpha reductase inhibitors.
5-alpha reductase inhibitors.
Yeah. These work by blocking the conversion of testosterone to dihydrotestosterone,
Okay.
a hormone that can stimulate prostate growth.
Okay.
Think of it like turning down the volume on, like, a noisy radio.
So it helps shrink the prostate by essentially quieting down those hormonal signals?
Exactly.
Okay.
Another type of medication is called alpha-1 blockers.
Alpha-1 blockers.
These work by relaxing the smooth muscle in the prostate and the bladder neck, making it easier to pee,
Okay.
like loosening a tight belt.
Ah.
You're relieving the pressure, allowing things to flow more freely.
Sounds much more comfortable.
Right.
But are there any downsides to these medications?
So, like any medication, they can have side effects.
Okay.
Some men might experience things like decreased libido, erectile dysfunction, or dizziness.
So it's a trade-off.
Right.
And it's important to talk to your doctor about the risks and the benefits.
Definitely.
What about surgery? Is that an option for BPH?
Surgery is usually reserved for cases where medications haven't provided enough relief,
Right.
or if there are complications.
Okay.
There are a couple of different procedures depending on the size of the adenoma.
Okay.
So for smaller adenomas, a TRRP, which stands for transurethral resection of the prostate,
TRP.
is a common procedure.
Okay.
It's done through the urethra, so no big incisions are needed.
So it's minimally invasive.
Yes.
Okay.
For larger adenomas, an open prostatectomy might be necessary, but that's less common these days.
And surgery also comes with potential risks and complications.
Of course.
Right.
Anytime you have surgery, there are risks involved.
Right.
For prostate surgery, some potential complications include retrograde ejaculation, where semen goes into the bladder instead of out of the penis,
Okay.
and urinary incontinence.
Right. Leaking urine.
Yeah.
So those are some things to consider.
Definitely.
Now let's move on to a topic that can be pretty scary.
Oh, yeah.
Prostate cancer.
Prostate cancer.
What should men be aware of?
Well, prostate cancer is the most common malignancy in men after the age of 50.
Wow.
But the good news is that thanks to PSA screening,
Okay.
it's often detected early when it's most treatable.
Okay, that's good.
Yes.
And our source material says it typically develops in the peripheral zone of the prostate,
Right.
which is the outer part of the gland.
Yes.
So what are the warning signs?
Unfortunately, early-stage prostate cancer often doesn't cause any symptoms,
Oh, wow.
which is why screening is so important.
Okay.
As the cancer grows, it might start to press on the urethra, causing problems similar to BPH,
Okay.
like, difficulties starting and stopping urination,
Right.
weak stream, or blood in the urine, or semen.
Okay.
You might also experience pain with urination or ejaculation.
Okay. And if it spreads beyond the prostate?
If the cancer metastasizes
Oh, okay.
to other parts of the body, you might experience bone pain,
Okay.
especially in the lower back.
Okay.
That's worse at night and doesn't go away with rest.
Okay, so how's prostate cancer diagnosed?
A digital rectal exam might reveal an enlarged, hard, or irregular prostate.
Mm.
But the PSA test is really key here.
PSA.
PSA stands for prostate-specific antigen,
Okay.
and it's a protein produced by the prostate gland.
Okay.
An elevated PSA level doesn't necessarily mean cancer,
Okay.
but it warrants further investigation.
And what kind of investigation are we talking about?
If a man has an elevated PSA, the next step is usually a biopsy.
Okay.
The doctor will use a thin needle to take small samples of prostate tissue guided by ultrasound.
Okay.
Those samples are then examined under a microscope to look for cancer cells.
Okay. And what about staging?
So staging helps doctors determine how advanced the cancer is
Right.
and the best course of treatment.
Okay.
They'll use imaging tests,
Okay.
like bone scans, CT scans, and MRIs to see if the cancer is spread beyond the prostate.
Okay, so once the cancer is diagnosed and staged, what are the treatment options?
That really depends on a number of factors, including the stage and grade of the cancer,
Okay.
the patient's age and overall health,
Okay.
and their personal preferences.
Okay.
So For low-grade, early-stage cancers, some men might choose active surveillance.
Okay.
This involves closely monitoring the cancer with, regular PSA tests and biopsies,
Okay.
and only intervening if it shows signs of progression.
So a wait-and-see approach.
Exactly.
Okay.
It's not for everyone, but for some men, it can be a good option.
Okay.
Um, for more aggressive cancers, or if the cancer has spread beyond the prostate,
Okay.
treatment options include surgery,
Okay.
radiation therapy, and hormone therapy.
Okay, let's start with surgery.
All right,
What's involved there?
the surgery for prostate cancer is called a radical prostatectomy,
Radical prostatectomy.
where the entire prostate gland is removed, along with the seminal vesicles
Wow.
and nearby lymph nodes.
Okay.
This surgery can be very effective in curing the cancer, but it can also have some significant side effects, including erectile dysfunction
Right.
and urinary incontinence.
Those are definitely things to weigh carefully when making a decision.
Yes.
What about radiation therapy?
Radiation therapy uses high-energy rays to kill cancer cells.
Okay.
It can be delivered externally, using a machine outside the body,
Okay.
or internally,
Okay.
using radioactive seeds implanted directly into the prostate.
Okay.
Radiation therapy can be a good option for men who aren't candidates for surgery
Okay.
or who want to avoid the potential side effects of surgery.
Right. And what about hormone therapy?
Hormone therapy aims to lower levels of male hormones,
Okay.
called androgens, that can fuel prostate cancer growth.
Okay.
This could be done with medications that block the production
Okay.
or action of androgens,
Okay.
or with surgery to remove the testicles.
Okay.
Hormone therapy can be used to shrink tumors before surgery or radiation. Or it can be used as the main treatment for advanced prostate cancer that is spread to other parts of the body.
So a lot to consider when it comes to prostate cancer treatment.
Definitely.
And how aggressive the cancer is plays a big role in determining the best course of action, right?
Absolutely. Doctors use a system called the Gleason grading system
Okay.
to assess how aggressive the cancer is.
Gleason grading system.
It's based on a scale of 2 to 10,
Okay.
with 2 being the least aggressive
Okay.
and 10 being the most aggressive.
Okay.
The higher the Gleason score, the more likely the cancer is to grow and spread quickly.
So a lot to think about when it comes to prostate cancer.
It is.
But the good news is there are effective treatment options available.
Definitely.
Now, remember that medical emergency I mentioned earlier?
Oh, yes.
Testicular torsion.
Testicular torsion.
Let's talk about that.
Okay, so testicular torsion is a condition where the spermatic cord,
Okay.
which supplies blood to the testicle,
Okay.
becomes twisted,
Okay.
cutting off the blood supply.
Ow.
It's incredibly painful and requires immediate medical attention.
Oh, wow. So how common is this?
It can happen at any age,
Okay.
but it's most common in newborns
Okay.
and during puberty.
What causes it?
Well, sometimes it's due to a congenital condition called the bell clapper deformity,
Bell clapper deformity.
where the testicle is, more freely movable within the scrotum,
Okay.
making it more prone to twisting.
Right.
It can also happen after strenuous activity,
Oh, okay.
or even for, seemingly no reason at all.
Okay. So what are the signs and symptoms?
The most common symptom is sudden severe pain in the scrotum,
Okay.
which might radiate up to the groin or lower abdomen.
Okay.
The scrotum might also be swollen, tender, and red, and the testicle might be higher than normal
Okay.
or lying horizontally.
And how is it diagnosed?
A physical exam is usually enough to suspect testicular torsion,
Okay.
but a doctor might use an ultrasound to confirm the diagnosis.
Oh.
This type of ultrasound uses sound waves to create images of the blood vessels,
Okay.
so they can actually see if blood flow to the testicle is compromised.
So this all sounds very serious.
It is.
What happens if it's not treated quickly?
If testicular torsion isn't treated within 6 hours, the testicle can be permanently damaged
Wow.
and might need to be removed.
That's a very tight time frame.
It is.
So how is it treated?
If the testicle is still viable, the doctor will perform emergency surgery to untwist the spermatic cord and restore blood flow.
Okay.
They'll also anchor the testicle to the scrotum to prevent it from twisting again.
Okay, that makes sense.
Yeah.
Let's shift gears now and talk about another serious condition affecting the testicles.
Okay.
Testicular cancer.
Testicular cancer.
So testicular cancer is the most common cancer in men between the ages of 15 and 35.
Right.
But here's the good news.
Okay.
It's highly treatable,
Yeah.
even when it's diagnosed in its later stages.
It is.
That's reassuring. So what are we talking about here? Different types of testicular cancer.
Yes. The
Prob-
vast majority of testicular cancers, about 95%,
Okay.
arise from germ cells,
Yeah.
which are the cells that produce sperm.
Okay.
These germ cell tumors are further classified
Okay.
as either seminomas
Okay.
or non-seminomas,
Okay.
with seminomas generally being slower growing and less aggressive.
Okay. And the other 5%.
Those are stromal tumors,
Okay.
which develop from the supporting tissues of the testicle.
Okay. So what are the risk factors for testicular cancer?
One of the biggest risk factors is cryptorchidism,
Cryptorganism.
or an undescended testicle.
Right.
If a testicle hasn't descended into the scrotum by puberty,
Okay.
the risk of testicular cancer is significantly increased,
Okay.
even if it's surgically brought down.
Okay.
Another risk factor is Klinefelter syndrome,
Klinefelter syndrome.
a genetic condition where males are born with an extra X chromosome.
Okay, so what should men be looking for? What are the signs and symptoms of testicular cancer?
The most common sign is a painless lump or swelling in the testicle.
Okay.
It might also feel hard or firm to the touch.
Okay.
Some men experience pain or discomfort in the testicle or scrotum,
Okay.
but that's less common.
Okay.
If it spreads, you might experience symptoms like lower back pain,
Okay.
shortness of breath, coughing up blood, or headaches.
Those don't sound good.
No.
So how's testicular cancer diagnosed?
The first step is usually a physical exam,
Okay.
where the doctor will feel the testicles for any, lumps or abnormalities.
Right.
If anything suspicious is found,
Okay.
they'll likely order a scrotal ultrasound,
Okay.
which uses sound waves to create images of the testicles.
Okay. And if the ultrasound shows a tumor?
Then a biopsy is usually done to confirm the diagnosis
Okay.
and determine the type of cancer.
Okay. What about blood tests? Are those helpful?
Absolutely. Blood tests can measure certain tumor markers, like alpha-fetoprotein,
Okay.
AFP,
AFP.
human chorionic gonadotropin,
Okay.
HCG,
HCG.
and lactate dehydrogenase,
Okay.
LDH.
LDH.
That can be elevated in testicular cancer.
Okay.
These markers can be helpful in diagnosing and monitoring the disease.
Okay, so what does it mean when doctors talk about staging testicular cancer?
Staging is based on how far the cancer has spread.
Okay.
Stage 1 is confined to the testicle.
Okay.
Stage 2 involves the lymph nodes in the abdomen.
Okay.
Stage 3 involves lymph nodes above the diaphragm,
Okay.
or other organs like the lungs or liver.
So how's testicular cancer treated?
The primary treatment for testicular cancer is surgery to remove the affected testicle,
Okay.
which is called a radical inguinal orchiectomy.
Radical inguinal orchiectomy.
If the cancer has spread beyond the testicle, additional treatments like chemotherapy
Okay.
or radiation therapy might be needed.
Okay.
Yeah.
Speaking of cancers that can spread, let's talk about bladder cancer.
Bladder cancer?
Bladder cancer is more common in men than women
Right.
and typically affects people over the age of 50.
Yes.
And these notes say it has the highest recurrence rate
Oh,
of any malignancy.
it's true.
Wow.
So it's important to be aware of the signs and symptoms
Okay.
and see a doctor if you experience any.
So where in the bladder does this cancer usually show up?
So most bladder cancers start in the trigone,
Trigone.
which is a triangular-shaped area at the base of the bladder,
Okay.
right where the ureters connect.
The ureters being those tubes that carry urine from the kidneys to the bladder?
Exactly.
Okay, so what are the different types of bladder cancer?
The most common type is transitional cell carcinoma,
Transitional cell carcinoma.
which accounts for about 90% of cases.
Okay.
This type develops from the transitional cells that line the inside of the bladder.
Transitional, like they can change shape.
Yes. These cells are pretty amazing. They can stretch and contract as the bladder fills and empties.
Wow, that's pretty cool.
It is.
So what causes this type of bladder cancer?
Smoking is a major risk factor,
Okay.
as is exposure to certain industrial dyes and chemicals.
Okay. And are there other types of bladder cancer?
There's squamous cell carcinoma,
Squamous cell carcinoma.
which is less common
Okay.
and often linked to chronic bladder irritation.
Oh.
Imagine like something constantly rubbing against the bladder wall, like a long-term catheter for
Okay.
recurrent infections.
Yep.
This constant irritation can sometimes lead to this type of cancer.
Wow.
And then there's adenocarcinoma,
Okay.
a rare but often more aggressive type that develops from glandular cells in the bladder.
Okay.
These glands are responsible for producing mucus,
Okay.
which helps protect the bladder lining.
Okay.
But sometimes these cells can become cancerous.
Okay, so what are the telltale signs of bladder cancer? What should people be looking out for?
The most common symptom, and often the first one people notice is painless hematuria.
Painless.
Yeah, blood in the urine.
Really?
Yeah. It might seem counterintuitive.
That
But
would...
many people with bladder cancer don't experience any pain, at least in the early stages.
Oh, wow.
As the cancer grows, though,
Okay.
you might start to experience other symptoms, like needing to pee more often,
Right.
urgency, a feeling that you haven't emptied your bladder completely,
Right.
and even pain or burning during urination.
So how is bladder cancer diagnosed if it's often painless at first?
So a urinalysis can detect blood in the urine,
Okay.
and sometimes a special test called urine cytology
Oh.
can even find cancer cells.
Okay.
But the gold standard for diagnosis is cystoscopy.
Cystoscopy? That sounds kind of intimidating.
Yeah,
What is that?
it's basically a procedure where a thin lighted tube with a camera
Okay.
is inserted through the urethra into the bladder.
Okay.
It allows the doctor to directly visualize the bladder lining
Okay.
and take a biopsy if they see any suspicious areas.
So like a tiny submarine exploring the bladder.
Exactly.
Oh.
And if they do find something suspicious,
Hmm.
they can take a small sample of tissue, a biopsy,
Right.
to examine under a microscope.
Okay. And are there other imaging tests used to diagnose bladder cancer?
Yes. Doctors often use CT scans and intravenous urograms to determine the stage of the cancer and see if it has spread to nearby lymph nodes or organs.
Okay, and speaking of staging, what does that mean for bladder cancer?
Staging describes how far the cancer has invaded the bladder wall.
Right.
And if it has spread to other parts of the body,
Okay.
the stages range from 0 to 4,
Okay.
with stage 0 being the least invasive,
Okay.
confined to the inner lining of the bladder.
So like a scale of severity.
Exactly.
Okay.
It's invaded the layer just beneath the lining.
Okay.
Stage 2 means the cancer has reached the muscle layer.
Okay.
Stage 3 has spread to nearby tissues or organs.
Right.
And stage 4 means it has spread to distant organs.
Okay. So based on the staging, how is bladder cancer treated?
For early stage bladder cancer,
Okay.
a common procedure is a TURBT, or transurethral resection of the bladder tumor.
Okay.
It's similar to the TURP we discussed for BPH,
Right.
where the doctor inserts a thin instrument through the urethra and uses it to remove the tumor.
Okay.
Sometimes, after surgery,
Okay.
patients will receive chemotherapy or immunotherapy directly into the bladder to help prevent recurrence.
So it's like giving the bladder a little extra boost
Exactly.
to fight off any remaining cancer cells.
Yes.
Okay.
For more advanced bladder cancer, a more extensive surgery called a radical cystectomy might be needed.
Okay, what does that involve?
In this surgery, the entire bladder, along with nearby lymph nodes, is removed.
Okay.
For men, this usually includes the prostate and seminal vesicles,
Okay.
while in women, the uterus, ovaries, and part of the vagina might also be removed.
Wow, that sounds like major surgery.
It is. And afterwards, the surgeon will create a new way for the body to store and eliminate urine.
Okay.
One option is to create a pouch from a section of the intestine,
Okay.
which is then connected to the ureters.
So the urine would drain into this pouch.
Yes. And then the pouch is connected to an opening in the abdomen called a stoma.
Okay.
So urine can be drained.
Okay.
Alternatively, the surgeon might be able to create a new bladder from a piece of intestine, which would allow the patient to urinate more normally.
Okay.
Yeah.
Okay, let's move on now to the kidneys
Okay.
and discuss renal cell carcinoma,
Renal cell carcinoma.
the most common type of kidney cancer.
Yeah. This type of cancer originates in the proximal convoluted tubules, or PCTs.
ACTs.
Imagine tiny winding tubes in your kidneys that filter waste products from the blood.
Okay.
Those are the PCTs.
And what causes this type of cancer?
Smoking is a big risk factor,
Okay.
as is exposure to asbestos.
Okay, so similar to bladder cancer in that regard,
Exactly. And just like with many cancers,
right?
certain genetic factors can also play a role.
I've heard there's a classic triad of symptoms for kidney cancer.
Yes.
What is that?
The classic triad is flank pain,
Okay.
a palpable mass in the abdomen,
Hey.
blood in the urine.
Okay.
But these days,
Oh.
most cases are actually found incidentally
Okay.
on imaging tests like CT scans or ultrasounds
Okay.
before any symptoms even appear.
So early detection is becoming more common,
Definitely.
which is good news.
Catching it early significantly improves the chances of successful treatment.
Right.
Yeah.
Now, earlier you mentioned something called paraneoplastic syndromes.
Paraneoplastic syndromes.
What are those?
So paraneoplastic syndromes are basically a group of rare disorders that occur when cancer cells produce substances
Okay.
that disrupt the normal function of other organs or systems in the body.
Okay.
So it's not the cancer itself causing the problem,
Okay.
but rather these substances it's releasing.
Okay. Think of it like this. The cancer cells are like little factories churning out these substances
Exactly.
that can mimic hormones and mess up different processes in the body.
Yeah.
So in the case of renal cell carcinoma,
Right.
these substances can cause a whole range of unusual symptoms.
I can.
So like what kind of symptoms are we talking about?
For example, some kidney tumors secrete a substance that mimics parathyroid hormone,
Okay.
which can lead to hypercalcemia
Okay.
or high blood calcium levels.
Okay.
Others secrete a substance that mimics adrenocorticotropic hormone,
Okay.
ACTH, which can lead to Cushing's syndrome,
Yeah.
a condition characterized by weight gain,
Okay.
a moon-shaped face, and high blood sugar.
Okay.
And still others secrete a substance that mimics prolactin,
Okay.
which can cause galactorrhea
Okay.
or the production of breast milk, even in men.
Wow, that is fascinating.
It is.
But also a little freaky.
Yeah.
Okay, so how do doctors diagnose renal cell carcinoma if the symptoms can be so varied?
Imaging tests, like CT scans, ultrasounds, and MRIs, are the primary tools for diagnosing it.
Okay.
And if a tumor is found, a biopsy might be done to confirm the diagnosis and determine the specific type of renal cell carcinoma.
Okay, so once they've got a diagnosis, how do they figure out the best treatment?
So staging is crucial for treatment planning.
Right.
It's based on the size of the tumor,
Okay.
whether it has invaded nearby tissues or organs,
Okay.
and whether it has spread to distant lymph nodes or organs.
So it's all about determining how advanced the cancer is.
Exactly. And the treatment really depends on the stage of the cancer and the patient's overall health.
Okay.
For small, localized tumors, surgery is often the preferred treatment.
Okay.
The surgeon might remove the entire kidney,
Okay.
which is called a radical nephrectomy.
Radical nephrectomy.
Or they might just remove the tumor itself,
Okay.
preserving as much of the kidney as possible.
Okay.
That's called a partial nephrectomy.
So they try to be as conservative as possible.
Exactly.
Okay.
If the cancer has spread to nearby lymph nodes or organs,
Okay.
surgery might be combined with radiation therapy or chemotherapy,
Okay.
and for more advanced cases that have spread to distant organs,
Right.
systemic therapies like immunotherapy or targeted therapy
Okay.
might be used to slow the growth of the cancer.
Okay, so lots of different approaches depending on the individual case.
Definitely.
But like we've seen with many of these urological conditions, early detection is key.
You got it.
The earlier it's caught, the better the chances of successful treatment.
Absolutely.
Well, that was quite a journey through some complex urological conditions.
It was?
It's like we've just completed a marathon of medical information.
I have.
But I think the key takeaway is this.
Okay.
If you experience any unusual urinary symptoms, don't ignore them.
Go see a doctor.
See a doctor and get checked out.
Yes.
Early detection can make all the difference.
It can.
That's great advice. And remember, this is just a glimpse into the world of urology.
The tip of the iceberg.
There's so much more to learn and explore.
There is.
But before we wrap up this part of our deep dive, I want to leave you with a thought.
Okay.
We've talked about a lot of conditions that are more common in men.
Yes.
So what can you do to raise awareness and encourage the men in your life, husbands, fathers, brothers, sons, to prioritize their urological health? Sometimes all it takes is a little nudge from someone who cares.
That's true.
So keep learning, keep those conversations going, and encourage the men in your life to take charge of their health.
I like it.
We'll be back soon with more insights from these fascinating medical notes.
Can't wait.
See you then. Welcome back to our deep dive into urology. I'm so excited to continue exploring these fascinating medical school notes.
Me too.
We've already covered a ton of ground.
We have.
But there's still so much more to uncover. So what's on the horizon? What are some of the most exciting developments in urology?
Well, one area that's really taking off is robotic-assisted surgery.
Oh, wow.
Imagine a surgeon sitting at a console, controlling tiny robotic arms that perform incredibly precise movements inside the body.
That sounds like something straight out of like a sci-fi movie.
It does, right? But it's very much a reality now.
It is.
Yeah. Robotic-assisted surgery is becoming more and more common for a variety of urological procedures, offering patients some incredible benefits.
So, what are the advantages of this robotic approach?
Well, for starters, the incisions are much smaller than with, traditional open surgery.
Okay.
That means less pain, less scarring, and faster recovery times for patients.
Right.
And because the robotic instruments are so precise,
Okay.
surgeons can often operate in, tighter spaces and with greater accuracy, minimizing damage to surrounding tissues.
So it's a win-win for both patients and surgeons.
Exactly. And it's not just about surgery. We're also seeing incredible progress in the development of new medications and therapies,
Oh, okay.
including targeted therapies that can, attack cancer cells more precisely, sparing healthy tissue.
Okay, so treatments are becoming more effective and less invasive.
They are.
It's amazing to think about all the possibilities.
It is, right?
And with all this ongoing research and innovation,
Yeah.
we can expect even better outcomes for patients with urological conditions in the years to come.
We can.
It's incredible to think about how far we've come.
It is.
Now, before we wrap up our deep dive,
Oh, boy.
I want to touch on a topic that's often overlooked,
Okay.
but so important: pediatric urology.
Oh, yeah. Pediatric urology.
So pediatric urology focuses on the unique needs of children
Right.
with urinary tract and genital conditions.
Yeah. It's a specialized area that requires expertise in dealing with, the challenges of treating young patients.
What kind of conditions are we talking about here? Like, what are some common urological problems that children face?
Well, some of the usual suspects are
Yep.
urinary tract infections,
Right.
bedwetting,
Okay.
vesicretal reflux,
Okay.
undescended testicles,
Okay.
and hypospadias.
Let's start with UTIs.
Okay.
We know they're common in adults, but how are they different in children?
UTIs in children can sometimes be a sign of, a structural abnormality
Yeah.
in the urinary tract. And if left untreated, they can lead to kidney damage.
So it's not just about treating the infection itself, but also looking for any underlying problems.
Exactly.
And what about bedwetting?
Bedwetting or nocturnal enuresis
Okay.
is common in young children, but it can persist into adolescence and even adulthood.
Really?
Yeah. It can have a big impact on a child's self-esteem and social life, so it's definitely something that should be addressed.
And vesicretal reflux?
VUR.
VUR.
So imagine a one-way valve
Okay.
that's supposed to keep urine flowing from the kidneys down to the bladder.
Right.
Well, in VUR, this valve doesn't work properly,
Oh, okay.
and urine can flow backward
Okay.
from the bladder up into the ureters,
Okay.
and sometimes even back up to the kidneys.
Oh, wow. So it's like a plumbing problem in the urinary tract?
That's a great way to think about it.
Okay.
This backward flow of urine can increase the risk of UTIs
Okay.
and kidney damage.
And we talked about undescended testicles earlier in the context of testicular torsion.
Right.
But it can also be a problem on its own.
Yes.
Okay.
Undescended testicles is a condition where one or both testicles fail to descend into the scrotum before birth or during infancy.
Okay.
It's important to correct this surgically
Okay.
because an undescended testicle has a higher risk of developing testicular cancer later in life.
So early intervention can make a big difference.
Absolutely.
And then there's hypospadias,
Hypospadias.
which is a congenital condition where the opening of the urethra is not located at the tip of the penis,
Right.
but instead somewhere on the underside.
Yeah.
So the urine doesn't exit in the usual place.
Exactly. It can range from a minor misplacement to a more severe case.
Okay.
But thankfully, it's usually correctable with surgery.
So many things to consider when it comes to children's urological health.
There are.
So what are some key takeaways for parents or caregivers who might be listening?
I think the most important message is this. If you notice anything unusual about your child's urination,
Okay.
genitals, or anything, related to those areas,
Right.
don't hesitate to talk to your doctor.
Okay.
Early diagnosis and treatment can prevent complications
Right. Yep.
and really make a big difference in a child's life.
That's such great advice.
It is.
It's important to remember that pediatric urologists
Yeah.
have special training and expertise in dealing with, these sensitive issues in children.
They do.
Right.
They understand the unique challenges of treating, young patients and can provide the best possible care.
Well, we've covered a lot of ground in our deep dive into urology.
It's been a journey.
Yeah. From everyday annoyances like UTIs and kidney stones to more serious conditions like prostate cancer and bladder cancer.
Right.
We've explored the complexities of this fascinating field. We've learned about cutting-edge treatments and the importance of preventative care.
Yes.
But most importantly, I think we've highlighted the power of knowledge
Definitely.
and an open communication when it comes to our health.
Absolutely.
You are your best advocate.
You are.
So true. The more you know, the better equipped you are to, take charge of your health and make informed decisions.
I agree.
And remember, seeking help when you need it is a sign of strength, not weakness.
Couldn't agree more.
Whether it's talking to your doctor, joining a support group,
Right.
or confiding in a loved one,
Yeah,
there's no shame in reaching out for support.
definitely not.
Keep learning, keep asking questions, and most importantly, take care of yourselves.
Yes.
That's all for this deep dive.
It's been great.
Thanks for joining us.